our expertise as a company is really around how to be a laboratory and how to close gaps and provide care for patients and plan members. Yet we also knew that our expertise was not in engagement and getting people to take health actions. And so we had the buy or build choice to make. And it was either do we go find expertise, bring it internal and build that, or do we simply partner? And simply is, really a misnomer, because finding the right partner is truly the key. Once we understood exactly what Revel does and why you do it and the science behind it, it was an easy decision. eTrue North works with a number of third-party organizations as part of our business model that we've put together. And contracting, master service agreement, SOWs, BAAs, all of the things in healthcare that are part of checking the box in that realm are typically somewhat painful. Our legal team is very particular and they love to redline things, but the contracting part with Revel was truly probably one of the most painless that we've been through. You were very responsive in how quickly you sent things that we were asking about, but probably more so than that, everything is very streamlined and it's very straightforward. It is probably one of the shorter agreements that we have, which to my mind is good because it's just clearly spelled out, and it's a quick process. Scalability is absolutely a huge issue and decision point for us as we were looking for our partner. In order to be able to scale, you have to prove that the model works, and then once the model works, you had to be able to turn on a dime and scale it quickly. And everything that we saw with Revel was that you have that ability, that Revel has been able to demonstrate with the clients that you have that you can start here and you understand what the business is, and you then take the feedback from a small pilot and then can quickly scale. And frankly, that was another capability that we wanted, was someone who can say, we did this, we learned this, applied that back to the model we had, and then scale it. Probably one of the biggest surprises that was absolutely delightful was coming to visit the Revel office and walking through, and just the people who work at Revel. Every single person I talked to had a smile. They were genuinely happy doing what they're doing. And the impression, as someone who was vetting the organization, was that everybody really wanted to contribute and felt like coming to work. And even though, again, it's you're doing something big, ultimately it's about you're changing people's lives. And that is the energy that I walked away with. And I knew from the first conversation in the office that we would work with you. I didn't tell you that, but I knew that. Data security is absolutely paramount because our clients, health plans, large wellness vendors, they're looking at us and asking, what is our level of data security? What is our platform credentials? And our platform is HITRUST certified. So therefore, you might imagine, as we're looking at partners, having a partner who is HITRUST certified was absolutely critical for us. For us, that makes the vetting process much easier because we know what we went through to be HITRUST. So if you're HITRUST, we know exactly the process that you've been through as well, and that level of scrutiny that's there. There are definitely, as you mentioned, the tried and true, right? There's letters, there's postcards, there are different ways of trying to engage people that, frankly, for years, were all we had. If the only tool you have in your toolkit is a shovel, it may have to act as a hammer, but it's still a shovel. And so the difference with Revel is it's now not just a shovel. It's all of these other tools in the toolkit to use, and the science behind the profiles and the fact that your team goes out and actually interviews people to find out you're a Medicare Advantage plan member, you're 10 different types of personalities of Medicare Advantage or Medicaid managed care, and what tools in the toolbox are the best solution to that. And there will definitely be people that the old shovel work for. And if it works, great, let's use it. If it doesn't work, or there's a sequence of communications that it takes on average 3 communications, or whatever the right magic number is, but there is definitely, again, science to that. I don't know that, but you guys know that. The pricing model and part of that contracting discussion that was very important to us is the fact that we have a very defined pricing model. We're only paid for success, if you will, and that model, we really wanted to be able to work with Revel in a comparable fashion. Part of what we are very clear with our plan clients about is that Revel does do the outreach and engagement for us. And we do that as a point of pride to say that we selected the best in the industry, and therefore we want you to know that Revel is our partner in this. We didn't want to go back to our plan clients and say, for Revel, you have to pay up front, but for us, we're purely performance-based, so that we now jointly say to health plans, we only get paid when gaps are closed. My personal background is I'm a registered nurse, and I got into nursing to help people, individuals. And yet here I sit today with this company that is really, I'm so far removed from the individual, and yet I still every night go to bed knowing that what we're doing is making a difference to one person. And at the end of the day, that's really what it's about. And so how do we have the greatest opportunity to help the most people?